Middle-aged white Americans are seeing increasing death rates, which are confusing researchers. Why is this happening? We see that while non-whites and younger people and people in other countries are seeing falling death rates, a new study shows that the opposite is happening for white men and women in the United States, age 45 to 54. What are the factors that researchers have connected to these rising death rates for white adults in the United States? Number one, suicide. A study shows that white middle-aged men and women are committing suicide at unrivaled rates. This connects to the mental health crisis in the United States. But the question still remains, why are whites more likely to commit suicide than other demographic groups? There's really no simple answer. Researchers say it has a lot to do with culture. They say, quote, "It is striking that suicide rates are highest in white females and white males. This is a complicated social and cultural phenomenon. It has to do with a mix of risk factors." They say this is not an urban African-American issue as much as it is a poor rural white male issue. Culture comes into play. A culture of not treating depression comes into play. The rural culture, if it's not broken, don't fix it. Very interesting. Also a factor, drug and alcohol abuse. Prescriptions for opioid drugs for pain control have increased significantly since 1990, and white people are exponentially more likely to be on those drugs. The New York Times reports that 90% of people who tried heroin in the last decade were white. Heroin often comes after being prescribed some kind of opioid painkiller by a doctor. That's another factor. And then the general decline in mental and physical health. Middle-aged white people reported problems with walking a quarter of a mile, climbing just 10 stair steps, standing or sitting for 2 hours. Even shopping and socializing were difficult physically, and those are huge risk factors for suicide. If physically you can't socialize, that is a risk factor, and the lack of socialization can make you more likely to commit suicide. So it all makes absolute sense. And lastly, another risk factor, financial stress. Financial insecurity weighs heavily on U.S. workers, and it is disproportionately affecting those without university degrees, often rural, white, middle-aged people in middle America. So this is a real problem, and the takeaway here is very clear. This is a suicide crisis that we're having, and we need to connect suicide to the lack of access to mental health and the stigma around mental health, the problems with wages, and the problems with access to health care, even for those who are cognizant of the reality that depression and anxiety should be treated by mental health professionals. Even if you can get past the stigma, the cost and access to mental health services is also a factor. And this is all connected to life expectancy. So when we say, hey, listen, let's let the for-profit insurance employer-connected status quo remain because of business reasons, well, you could make that argument, but that's not a very ethical argument when you see how it directly correlates to increased death rates for many groups, this particular study focusing on middle-aged white men and women. Very disturbing stuff, and we need to not forget this in the context of discussions about healthcare as we proceed. After the break, I will interview cosmologist Lawrence Krauss, one of our favorite guests on the show. How can we think about what there was before there was a universe? He joins me next.